Call this meeting of the Joint Appropriations on Health and Human Services to order March 5th at 8:30. Take their seats, please. I'd like to first thank our Sergeant at Arms from the Senate. We have Gary Bridges. Where's Gary? There he is. Rod Fuller. There's Rod. Sherry Hedrick. Sherry. And from the House, Nina Lodge. Am I saying that right? Nina, I'm sorry. Nina, thank you. Terry McCraw. Terry. And Malachi McCulloch. Yep, thank you. I think we have some pages here this morning. Is that right? Yep. I'll call your name out if you'd like to wave your hand and say who your sponsor is. Akila Anderson. And you're sponsored by Speaker Destin Hall, is that right? All right. Ethan Burkett. You're sponsored by Speaker Destin Hall. And Daniel Echeverria, sponsored by Representative Brian Echeverria. Welcome this morning. All right, so we have two items on the agenda this morning. So the first one is the Division of Social Services Overview and Budget. I'm going to turn it over to Fiscal Research Division and Francisco Celis Villagrana.
Thank you, Mr. Chair. Committee members, good morning. My name is Francisco Celis Villagrana with Fiscal Research on the Health and Human Services team. Backed by popular demand, today I'll be providing you all with an overview of the Division of Social Services. So I'll begin with a brief, broad overview of the division, and then I'll review the division's budget, after which I'll review the services and programs managed by DSS, which generally fall into either child welfare services or economic services. And then I'll finish the presentation by highlighting some of the significant budget actions taken during this fiscal biennium. So starting with the general overview, for the most part, in North Carolina, social services are federally mandated, state supervised, and county administered. And as I mentioned in last week's Central Management and Support presentation, North Carolina is one of 9 states in the U.S. that has this sort of decentralized system. So this means that the federal government mandates most of the large social services and provides a large part of the funding for them. And then at the state level, the Division of Social Services provides the oversight, guidance, technical assistance to the 100 county departments of social services, which are the entities that are actually on the ground floor managing the delivery of services and benefits to the public. Because North Carolina has this decentralized system, the North Carolina General Assembly in 2017 in a law known as Ryland's Law directed the Division of Social Service to look into creating regional offices to provide an added layer of support and oversight to the county departments of social services. These regional offices have been deployed for about a year now, and as you can see on the map there are 7 regions. Each one has a regional office with 11 state employees, and that includes a director, as well as child welfare, adult services, and economic benefits staff. And aside from providing oversight and supervision, these offices also work with counties to disseminate best practices, provide policy guidance, technical assistance, training, and quality improvement. So this slide includes the list of services that the division oversees. I'll run through them briefly now because I'll be doing a deeper dive later on. So child welfare services includes child protective services, foster care, adoption services, and other family and community-based in-home services. Then child support services assist with the collection of child support money from non-custodial parents. Work First Family Assistance is a program that helps parents support their families while also providing the families with short-term training and other counseling and assistance services to help them become employed. Then there are a couple of federally funded energy assistance programs that help low-income households pay for energy bills as well as deal with energy crises. And lastly, refugee services, which are also fully federally funded, help refugees transition into living in the United States. So moving on to this division's budget, starting with a 5-year history. As you can see, the total budget has not varied too much over the last 5 years. It has grown about 10% overall. There was a larger budget last year due to one-time funding items, as well as the fact that a lot less money reverted in the previous year than historically with this division. There has been a significant increase in net general fund expenditures over the past 5 years, and that can largely be attributed to funding for child welfare initiatives, which I will be covering later on. A big takeaway from this graph is just how much of the budget is supported by receipts. You'll see that about 90% each year of the budget comes from receipts, and most of those receipts are federal funds. Taking a closer look at the current fiscal year's authorized budget, over 96% of the budget goes towards aid and public assistance, and those are the distributions of funds to direct recipients, as well as provision of services to the public. I'll also mention this division has 373 full-time equivalent positions and a vacancy rate of about 20%, which is on par with the rest of North Carolina state government agencies. This next figure, we're still looking at the current year's authorized budget, but now we're looking at where the funds are coming from. So you can see federal funds make up almost half of where the dollars are coming from at around $1.1 billion. Then county funds make up the next largest share at around 38%, with net general fund appropriations making up a little over 10% of the current authorized budget. Now looking at a breakdown of the current authorized budget by the program or service area, you'll see that child welfare makes up the largest piece at 37%. And then the next largest slices, Medicaid eligibility, aging and adult services, and food and nutrition services are programs that are actually not managed by the Division of Social Services. Rather, they're managed by other divisions. However, the funds for these services do sit within this division because these are mostly funds that are going out to county departments of social services. And the Division of Social Service has the infrastructure and experience in place to flow those funds out to the counties, and so that's why those funds are sitting within this division, even though these services aren't actually directly managed by the division. In terms of services that are managed by DSS, next there's child support at about 8% of the budget, energy assistance at 7%, work first at 4%, leaving 6% for other services and programs. Now, if we look at what programs and services are being funded just with the net general fund appropriations, you'll see that child welfare makes up about 2/3 of that, with aging and adult services making up over a quarter. And again, aging and adult services are generally managed by the Division of Aging and Adult Services, which I'll be presenting on tomorrow. So really, if you discount that, most of the state dollars are going primarily towards child welfare services. So keep that in mind as I now review the child welfare services that are managed by the Division of Social Services. In this slide, I'll quickly review a graphic that lays out the process when there is a report of child abuse or neglect. So Child Protective Services workers intake or receive reports. They then assess them, and if an investigation is needed, they'll conduct those to determine if there was any safety or risk concerns, and if so, whether the child needs to enter foster care or if the family can stay within their home if the family agrees to receive in-home services. If the child does enter foster care, there's a variety of settings that the child can enter, and I'll go over those placements later on. And a child in foster care, typically the goal with them is to either reunify them with their original parents or caretakers if that is a viable option, or to have them be adopted or be placed in a guardianship relationship. And as Deputy Secretary Susan Osborne said yesterday, best practice is to place children with relatives, both when they're in foster care or with permanent placements if reunification is not a viable option. So again, child welfare services generally begin with child protective services, which again are intended to prevent further harm to children. And they screen the reports of child abuse and neglect, assess them, provide the investigations in homes, and determine if maltreatment has occurred. And again, if so, they can petition the court to remove the child from their home or refer the family to receive in-home services if it's safe for the child to remain in the home. So on this slide, you can see the number of CPS assessments completed per month in blue, and the total number of children involved in CPS assessments per month in orange. This is over a 5-year period beginning in July 2017. And you'll notice that there's approximately double the number of children than cases. So there are approximately 2 children involved per CPS assessment. Though the number of cases and children does vary month to month, there is that seasonality that is mostly driven by the school calendar. Overall, the numbers haven't changed too much over this 5-year period, though they have seen a slight decrease. Now, as I mentioned, a CPS worker can determine that a child can safely remain in their home and receive in-home services instead of entering foster care. And the point of these services is to resolve the root issues that lead to maltreatment in the first place in order to make it unnecessary to place the child outside of their home. Historically, what the division has done is contract with service providers throughout the state to provide intensive family preservation services, or IFPS, for families to receive a variety of evidence-based programs, which can include family therapy, parenting, teaching support, substance use treatment, for example. And in fiscal year 2024, 682 households received these services, which is a slight decrease from the past because the division is currently downscaling these services in order to focus on upscaling a specific evidence-based in-home service known as Home Builders. And Home Builders is an evidence-based program that provides counseling to families over 4 to 6 weeks and to try to reduce familial conflict. It's currently being implemented statewide and may soon begin to receive federal reimbursements for the costs of providing this service. In fiscal year 2024, 146 households received this service, though that is expected to grow as this program is upscaled and expanded statewide. There are other in-home services that the division has been piloting in some counties, such as Child First NC, which is focused more on families with younger children. The sobriety treatment and recovery teams, which target parents suffering from substance use. And Parents as Teachers, which teaches young parents to promote positive child development. And this is a program that DSS is planning to implement statewide after the implementation of Home Builders. Now, if a Child Protective Services worker determines that a child cannot remain safely in their home and needs to enter foster care, what foster care entails is that the state and the counties are tasked with ensuring that a child's physical, behavioral health, educational, and developmental needs are met. Ultimately, the goal is to have children in foster care either be reunited with their original parents or caretakers, although if that is not a viable option, then to have them adopted or in a guardianship situation. Although if these are not viable options or they're not able to be accomplished, foster care services also entails supports provided to youth that are aging out of the system so that they can be ready for the world and be self-sufficient. This slide shows the number of children and youth in regular or extended foster care over a 5-year period starting in July 2019. I do mention extended foster care because since 2017, children who age out of the foster care system in North Carolina can continue to receive foster care services until reaching 21 years of age if they meet certain criteria. So the total number of foster children and youth has come down slightly in this 5-year period, but overall it's remained relatively constant. Now we're looking at the number of children and youth in regular or extended foster care over a roughly 4-year period, but by the placement type. And you'll see the solid light blue line near the top is the number of children placed in licensed family foster homes, and that makes up nearly half of the placement settings currently, or at least as of June 2024. Then the darker solid blue line below is the number of children placed with relative caretakers who are unlicensed, and these are oftentimes called unlicensed kinship care homes, and that makes up about a quarter of the placements. I'll mention that in November of 2023, with direction and funding from the North Carolina General Assembly, the Division of Social Services began providing financial assistance payments to these families, whereas previously there was no direct financial assistance provided specifically for foster care for unlicensed homes. And so we do observe at around that time that there's been a slight uptick in these sorts of placements since then. Then the dotted blue line below that shows the number of children in group homes. These are also called sometimes residential homes or congregate care homes, and that makes up around 12% of the current foster care population. Going back to unlicensed homes, I will also mention that the division is currently working to create a separate licensing program for relatives that is more streamlined than the regular license process for foster care parents, in order to encourage more of these relative families to get that licensing and then be able to draw down the full benefits for providing foster care. So these families in group homes that are caring for foster children do receive monthly assistance payments depending on the age of the child as well as where they are placed. So for regular licensed family foster homes, the current monthly assistance rates, which did increase in July of 2023, go from $702 to $810 per month, depending on the age of the child. Then, as I mentioned, with kinship care homes, those unlicensed relative families, they have begun receiving assistance since November of 2023, and those payments are set at half of the regular licensed care rates. There are also rates paid out to the group homes, as well as rates paid out for private licensing agencies for the administrative and case management services provided for children in foster care. Now, a topic of interest regarding the state of child welfare in North Carolina recently has been the placement of children in inadequate settings such as county departments of social services, hotel rooms, and emergency department rooms. This graph shows the number of children who've spent at least one day during the month in one of these settings, as well as the number of children on the last day of each month in one of these settings since November of 2023, when the division first started collecting this data in a statewide standardized way. So you can see this has been occurring a bit more over time since data collection began. Now, the Division of Social Services has taken steps to mitigate the use of inadequate settings, and as you all heard yesterday, primarily the division is leveraging funds from the $80 million ARPA Temporary Savings Fund that was provided by the General Assembly for child welfare and family well-being initiatives. So I won't go over this slide in more detail because you all heard more about it in yesterday's committee presentation provided by the department, but just to highlight, there was the DSS Emergency Placement Fund, and then other initiatives that are currently ongoing or being planned are professional foster parenting and enhanced emergency care placements. So the last important topic I want to touch on regarding child welfare in North Carolina is the Family First Prevention Services Act. This is a federal law that passed in 2018, but went live in North Carolina in October of 2021. And it has two key provisions. The first being that the federal government no longer provides reimbursement for group home settings after the first 2 weeks of a child being placed in a group home. So as a result, the North Carolina General Assembly since 2021 has appropriated nearly $30 million to bridge that gap due to the loss of federal funds for foster children who are being cared for in these group settings. I will note that this $30 million has been provided on a non-recurring basis, so this might be an area that the General Assembly may be asked to continue to step in. The second main provision allows the federal government allows the state to receive federal dollars to be reimbursed for the cost of services provided to families in home that are attempting to prevent children from entering foster care in the first place. And these programs do have to be signed off by the Federal Administration for Children and Families. And as I mentioned, Home Builders is the program that DSS is currently working to build out statewide, and by doing so should soon be able to receive federal reimbursement for those services. And then Parents as Teachers is currently being planned to be the next evidence-based in-home program that will be eligible to receive federal reimbursement dollars. The last slide I have on child welfare is on adoption services, which are provided when county departments of social services or private child placing agencies find a family to adopt a child from foster care when they are not able to reunite them with their original parents or caretakers. So case managers work to recruit, assess, and select adoptive homes. They also finalize the finalization of legal adoption, and the division provides pays for most of the costs related to adoption from foster care. And then caseworkers also provide post-adoption services to try to sustain the placement. In the last full fiscal year, nearly 1,200 foster children were adopted, and most of the families who adopt from foster care are able to then receive monthly adoption assistance payments until the child reaches the age of 18. And as you can see on the table in the bottom right, these rates, which were increased in July of 2023, mirror those paid out to licensed foster care families. All right, the next services I will cover are the economic services. Starting off with child support services, this involves locating non-custodial parents, establishing paternity, petitioning the court for child support orders, as well as collecting and dispersing child support payments. These services are provided at all 100 counties throughout the state, mostly through county departments of social services, although some counties do have other entities that are providing these services. In the last full fiscal year, there were over 326,000 cases of child support, and the state collected and dispersed around $644 million in child support payments. So moving right along to the next economic services program called Work First. This is North Carolina's Temporary Assistance for Needy Families, or TANF program. So it's mostly funded through federal TANF block grant funds. Although there are federal parameters on how this program has to operate, North Carolina does have the flexibility in setting eligibility standards and benefit amounts. And there's really three forms of assistance that individuals and families can receive through Work First, although the primary one is family assistance, which provides monthly financial assistance to families to help care for them and their children, while providing services to the adults in the family so that they can enter the workforce. Some counties can also opt in to offer families one-time diversion assistance, which is a larger one-time payment that is provided to families if it's identified that their need is more short-term and does not require kind of the ongoing monthly assistance. Then the services that are provided through Work First include transportation, job search help, skills training, counseling, things like that in order to help the families become self-sufficient and get parents working. And then emergency assistant provides families with one-time lump sum assistance amounts limited to the 3 months that a family would otherwise receive monthly assistance. And that's in order to meet kind of one-time needs such as a utility cutoff or an eviction notice. And for services and emergency assistant, county departments do have flexibility in setting the income limits. So since Work First Family Assistance is kind of the main Work First assistance type that's provided, I'll be focusing on that in this slide. And yes, you can see on the graph the number of cases over a 5-year period is seen there, starting with November of 2019. So as I mentioned, families where there is a parent or parents, in those cases, the parents are required to enter a work agreement to demonstrate their intent to attain employment, and they are offered services to help them do so. However, most cases in Work First Family Assistance are actually child-only cases, and they're called this because there are no adults in those cases. These are typically households in which children are being cared for by relatives, such as grandparents caring for grandchildren. And in these cases, the children themselves are eligible to receive the Work First Family Assistance, but the relative caretakers are not included in the case, and that's why these cases are known as child-only. And as you can see on this graph, the darker portion represents these child-only cases, and those are a majority of the Work First Family Assistance cases. As of November of 2024, they actually represent nearly 80% of the Work First Family Assistance cases. I'll also point out that in federal fiscal year 2023, the average monthly assistance amount was $209 for families receiving Work First. In the table on the bottom right, you can also see the monthly income limits and the monthly maximum benefit amounts, and those are set by the state through general statutes. On this slide, there are two economic assistance programs related with energy assistance, and both of these are fully federally funded. The first program is called Low Income Energy Assistance Program, and it provides low-income families with one-time assistance payments to help them pay for energy bills. Households with disabled or elderly individuals are prioritized for services, and they are also subject to a higher income limit. In the last full fiscal year, over 132,000 households received benefits through this program, averaging at around $367. The next program is Crisis Intervention Program. Again, it's fully federally funded, and it assists households experiencing a heating or cooling crisis that threatens their well-being. Families do have to be low income, and assistance can take the form of help with utility payments, but they can also take the form of heating and AC units provided to families, temporary shelter, minor home repairs and modifications, space heaters, warm clothing and blankets, things like that. And in the last full fiscal year, over 84,000 households received benefits through this program, which averaged at $353. Onto the last economic services program I'll cover is refugee assistance. These programs are fully federally funded, and cash assistance provides financial help to refugee families who are otherwise ineligible for other cash assistance programs, such as Work First. And the income limits and benefit amounts for this program are also set to mirror those of Work First family assistance. This form of assistance is limited to 12 months, and there were over 2,500 recipients in the last full fiscal year. Medical assistance is also provided to refugee families for 12 months if they're not otherwise eligible for Medicaid. These families do have to have incomes below 200% of the federal poverty level. And in fiscal year 2024, 2,800 recipients did receive medical assistance. Support services, again, fully federally funded, and these include employment services such as job search help, English language training, as well as other support services like transportation, translation services, and other social adjustment services intended to help families assimilate into living in the U.S. So I'm on to the last section of this presentation where I'll go over some significant budget actions from this fiscal biennium. I'll first talk about funding provided through Session Law 2023-14, the Care for Women, Children, and Families Act. So if you look at the first three bullet points, nearly $12 million recurring net general fund appropriation were provided to increase the various monthly foster care and adoption rates, which you all saw in previous slides. Also, nearly $6 million recurring dollars were provided to set up that program, providing assistance payments to the unlicensed kinship families providing foster care. Then $700,000 recurring was provided towards the state maternity home fund. And then nearly $12 million in non-recurring dollars were provided to continue to cover the cost of children being cared for in group homes. Again, this is as a consequence of the federal Family First Prevention Services Act, which reduced the amount of federal reimbursement that the state receives for children in group homes. Next, I'll talk about items in the 2023 Appropriations Act. There was $3 million recurring provided to child advocacy centers, which provide evidence-based services to sexually and physically abused children and their families. Next, there was $1.6 million recurring starting in the current fiscal year, as well as $7.5 million non-recurring from the IT reserve fund provided to replace the division's county reimbursement IT system. Then $750,000 recurring each year, and a one-time total of $1.4 million from the IT reserve provided to replace the division's child support IT system. $600,000 recurring each year net general fund appropriations provided to fund the 6 director positions for those regional support offices, which I covered at the start of this presentation. And then nearly $1.5 million total non-recurring for the development and implementation of a statewide trauma-informed assessment to be used for children and youth in the child welfare system. Next, I'll talk about items that were provided through the Disaster Recovery Act of 2024, Part 2. And there were 4 appropriations from the Helene Fund that went towards the Division of Social Services to distribute funds to county departments of social services. So $9 million was provided for energy assistance to households, $3 million to provide essential services and supports for children involved in the child welfare system, $1.4 million to provide essential services and supports to vulnerable adults, and lastly, $1 million to provide households with rental assistance. All right, I appreciate you all hanging on through this long presentation. I'll go over some takeaways now. So the Division of Social Services is tasked with overseeing and supporting the administration of social services by the 100 county departments of social services. Those are the entities, again, on the ground floor that are actually doing the administering of services and benefits. Most of the social services covered today are mandated by the federal government, and the federal government also provides most funding for these programs. In terms of the state dollars, most of those go towards child welfare services. And as we saw today, there were many recent initiatives surrounding child welfare, which include the deployment of regional support offices, the creation of unlicensed kinship assistance program payments, increased foster care and adoption rates, funding for various technology system updates, and funding for in-home preventative services and bridge funding for group home placements, both of these items as a response, again, to the Federal Family First Prevention Services Act. Mr. Chair, I do have an appendix with additional foster care information, but that does conclude my presentation, and I'm happy to take questions.
Thank you, Francisco. I think with other presentations, we'll save questions for the end, but I appreciate it. So we'll move into our next presentation, Division of Public Health Budget and Program Interview. Susie Camilleri.
Thank you, Mr. Chair. Good morning, chairs and members of the committee. My name is Susie Camilleri, and I'm with the Fiscal Research Division at the North Carolina General Assembly. And today I will be talking about the Division of Public Health. And I will follow the familiar roadmap, starting with their authorizing laws and responsibilities. So the division and its duties are housed under the Department of Health and Human Services under Article 3 of Chapter 143B. Each state has jurisdiction over its own public health systems infrastructure, and in North Carolina, Chapter 130A governs the public health law for the state. At a high level, the state must ensure that all citizens in the state have equal access to essential public health services and to promote and contribute to the highest level of health possible for the people of North Carolina. Under Chapter 130A, the state is tasked with responsibilities listed on this slide, namely identifying, investigating, mitigating, and preventing the spread of various diseases and health risks, promoting healthy lifestyles, and providing healthcare services where needed. In order to accomplish these tasks, the state establishes and enforces statewide public health rules, administers statewide public health programs, and monitors local compliance with state laws and rules, provides technical assistance to locals, and distributes federal and state funds to local health departments. The state is not the only entity under Chapter 130A with the legal authority of promoting the state's public health. In North Carolina, this responsibility is shared between primarily the state and local health departments. And while public health services are primarily regulated by the state and provided by local health departments, the federal government does influence state policy primarily by providing funding for specific programs or purposes. At the state level, the primary actors are the Secretary of DHHS, the Division of Public Health, and the Commission on Public Health, which is the primary rulemaking body for public health in the state. And this presentation focuses on the Division of Public Health, which is the primary agency responsible for carrying out the state's public health mission. There are 86 local health departments serving the 100 counties in North Carolina under oversight by the state, and they are statutorily required to provide these 10 public health functions, which I will not read out to you, but I did include them here as a reference, and we will also spend some more time talking about local health departments in a few moments. We'll look at the division's budget for these next several slides, and probably unsurprisingly at this point, they are majority receipt supported, mostly through federal grants and fees. There is on the table, you can see some additional funds back in 2021 and 2022, and these are related to the state's COVID response. There is a significant decrease in the division's budget starting in fiscal 22-23, and that's primarily related to the establishment of the Division of Child and Family Wellbeing, which I covered, I think that was yesterday. The days are running together. But several programs from DPH did move to that division along with the funding and the staff. This slide breaks down the division's requirements by purpose with a total of about $576 million in requirements. Again, probably unsurprisingly, the largest section does go toward aid and public assistance, with a lot of these funds flowing to the local health departments to provide services to the public. And then staff does make up the next largest section of requirements. The division has 1,200 FTE with a 15% vacancy rate. Again, that is lower than the department's rate as a whole of 24%. And the majority of staff in the division are under epidemiology, the state public health lab, administration, and the medical examiner's office. Looking at requirements by program area, epidemiology does take up 40% of the division's budget, followed by women, infant, and community wellness section and the public health lab. Together, these three sections take up about 70% of the $576 million budget. Looking at just the net general fund appropriation by area, we see that the women, infant, and community wellness, the medical examiner's office, and epidemiology section make up about 63% of the budget. The public health lab comes in at about 5% of net general fund, as it is mostly supported through federal funds and some fees. Next, we will look at branch divisions, and we'll take a deeper dive into a few of them because, as you can see from this slide, the branches are varied and cover a wide range of public health responsibilities. And we do not have the time, unfortunately, to look at each of them. But today we will focus on a few areas that have been the subject of recent legislative actions, including local health departments, the Office of Vital Records, and the Office of Chief Medical Examiner. We'll start with an overview on local health departments, since they do deliver many of North Carolina's public health services. They receive funding from a variety of sources, including the state, county funds, and the federal government. And the table shows the types of services that are provided through the local health departments with oversight and support from the Division of Public Health. Not all local health departments look alike in the state, and we'll talk about a few of the ways that they may differ. First, the counties may choose to form district health departments, which are 2 or more counties that agree to pool resources to assure provision of public health services for the counties that they serve. As you can see on this map, most local health departments in the state serve a single county, but there are 6 districts serving a combined 20 counties across the state. Counties may also choose to combine 2 or more human service agencies into a single consolidated human service agency. And this map shows the varying agency structures across the state, with 67 counties choosing to have separate public health agencies, not combined with any other human service agencies. And the governance structure may also differ by local health department. They may be governed by a public health board, a consolidated human services board, or the Board of County Commissioners can directly assume the powers and duties of one or more of the governing boards responsible for overseeing local human service agencies, either the local health board, the county board of social services, or the consolidated human services board. And if that's the case, they will appoint an advisory committee on health. Consolidated human services and public health boards are appointed by county commissioners, and public health boards govern LHDs in 63 counties, including the 6 districts that serve the 20 counties that I mentioned on the previous slide. The Division of Public Health, I upgraded you, has oversight over state, federal, and other funds that flow through the state treasury to local health departments, with the source of funding varying by local health department. Federal funds may also be received directly by LHDs or indirectly through DHHS. To receive funds that flow through the state, the local health departments are required to enter into a contract with DHHS, which is called the Consolidated Agreement. And this contract pertains to all activities offered by the local health department for which they receive funding from the state. Funding formulas for LHDs vary and may depend on a combination of population or need-based allocations. And failing to comply with this agreement can result in loss of funds for the local health department. I'll also note that Medicaid is a significant source of direct support for local health departments for the services that they provide to Medicaid eligible clients. And while most funds are earmarked for specific purposes, there is about $11.3 million recurring in state net general fund appropriations that flow through the division to general aid to counties, and this is the most flexible source of funding that LHDs receive from the state, and they can use it to address essential services and operations needed in their specific county. Next, we'll look at the Office of Vital Records under the Division of Public Health. In partnership with local health departments, county registers of deeds offices, and birthing facilities, the office legally registers all births, deaths, fetal deaths, marriages, and divorces that occur in the state. They maintain our vital records, provide copies when requested by individuals, researchers, and public health programs, and they also track vital events for statistical purposes across the state. This slide shows OVR data for calendar year 2023, which is the most recent year for which data is available. In that year, they registered over 300,000 vital events, processed about 45,000 requests for certificates, and 6,000 requests for amendments. It also provides a table of estimated processing times for varying services, with non-digitized certificate requests having the longest average processing time of about 60 days. Next, we'll walk through the certificate order fulfillment process, which is shown on this slide, which begins when a customer places an order for a certificate with the Office of Vital Records. The order is then sorted by staff to determine the appropriate processing path. And if the requested certificate is digitized, it's issued directly from the North Carolina Database Application for Vital Event System known as NC-DAVE, and then it is completed. However, if it is not digitized, staff must manually search the database for the file number, and if the record is available on microfilm, they will retrieve it and check if it's usable. If the microfilm is usable, the certificate is printed from it. However, if it's not, staff must retrieve the original book from the vault and copy the certificate onto security paper for issuance. And once the certificate is prepared, the order is finalized and closed in NC-DAVE, which marks the completion of the process. Completing certificate orders for non-digitized records is a time-consuming process, and OVR is currently working to digitize records to improve timeliness and efficiency. Next, we will take a look at the Office of Chief Medical Examiner system. By law, the state's medical examiner system must investigate certain types of deaths, including those by injury, violence, and natural deaths that are suspicious, unusual, or unattended by a medical professional. The chart on the slide shows data on death investigations and autopsies performed for the past 5 calendar years. There are typically over 100,000 deaths that occur in the state each year, the majority of which do not require an investigation or autopsy. And you can also see that of those that do require an investigation, only a fraction of them go on to require an autopsy. Since 2019, there has been a steady incline in investigations, which has been driven by a few factors. Of course, the COVID-19 pandemic resulted in an increase in investigations, but the fentanyl epidemic has also contributed to this rise as well. We did see a slight decline in 2023, but the number is still up compared to pre-COVID, again, largely due to drug overdoses and also an aging population. And in addition to investigating these deaths, medical examiners also testify in judicial proceedings, and data from the medical examiner system is used to track decedent trends to support broader public health responses. This map shows an updated jurisdiction of the autopsy centers to account for a new regional autopsy center that just recently went online. Along with the state-run medical examiner office here in Raleigh, there are 4 regional-based autopsy centers and 2 hospital-based pathology practices, which are contracted-based. The 4 regional autopsy centers are located at ECU School of Medicine, Wake Forest Baptist Medical Center, Mecklenburg County Medical Examiner, and the South Piedmont Autopsy Center, which just recently became operational. And you can see the counties that each of these centers serve on the map. I know it's a little bit small, sorry about that. OCME is charged with overseeing the operations of the entire state medical examiner system, and their lab, toxicology lab, serves all 100 counties. The current reimbursement rate for autopsies is $5,800, and this is split between the state and the county in which the deceased resided. However, if the death occurs outside the county of residence, the state will pay the entire fee. I'll conclude my overview of OCME by taking a look at the role of county medical examiners in the system. The chief medical examiner appoints 2 or more medical examiners per county for a 3-year term, and there are about 340 across the state. They assist with death investigations, decedent management, and decide whether a death falls under the OCME jurisdiction. They also certify deaths and file reports with OCME. I'll note that these are not full-time employees. They are not state employees, and they receive a $200 fee for each investigation that they perform. The column on the right shows a list of licensed professions that are allowed to become CMEs by law, with preference given to physicians. And I'll conclude by looking at some recent legislative actions that impacted the division, starting with the 2023 Appropriations Act. The Office of Chief Medical Examiner received additional funds to increase the autopsy fee from $2,800 to $5,800, to increase the capacity of the medical examiner system, and as I mentioned, to establish the new South Piedmont Regional Autopsy Center that currently just went online, serving 3 counties, and over time, as the new building is constructed and staff are hired, they will eventually serve 9 total counties. DPH also received funds to establish a state office of child fatality prevention, which they are currently standing up. And there was also recurring funding for grants to pregnancy centers for services, equipment, and training. In the 2023 budget, the Office of Vital Records received non-recurring funds from the ARPA Temporary Savings Fund and also from the General Fund to continue its certificate digitization efforts that I mentioned earlier. They're almost complete with the first phase, which includes digitizing records from 1961 to 1970. Local health departments also received ARPA Temporary Savings Funds, and this was for $50,000 grants to each LHD for additional flexible aid to county funds. The 2023 budget also appropriated additional jewel settlement funds that run through the division. To date, $35.5 million in jewel settlement funds have been appropriated for DPH, to DPH for electronic cigarette and nicotine dependence prevention and cessation activities targeting younger students. DPH also received $3.5 million recurring in the Care for Women, Children and Families Act. And these funds are for competitive grants to local health departments and nonprofit community health centers to provide long-acting reversible contraceptives. There are 16 LHDs and 11 community health centers currently receiving grants from these funds. And then finally, in the Second Disaster Recovery Act of 2024, the department received $12 million from the Hurricane Helene Fund to go directly to local health departments to restore essential services. Funds were distributed to 22 counties in the western part of the state. They each received a base amount of just under $220,000 and an additional amount based on need and population size. And they could use those funds as needed in their county. And with that, Mr. Chair, happy to stand for questions.
Thank you, Susie. I really appreciate your presentation. Before we go into questions, I was pointed out that I missed a page list. Audrey Nam, are you here? Oh, there you are. You're on the other side. You're here paging with, sponsored by Senator Applewhite, correct? Welcome this week. Thank you for being here. All right, so now we will start with questions. I will go to Chair Bergen first to get us started.
Thank you, Mr. Chair. And with your permission, I'll do the same thing I did yesterday and just give you all some questions, and then you can just reply, send them all back to the chair or everyone, whatever's easier for you all, and then I'm sure the chair will get them to everybody on the committee. Mr. Chairman, how many states currently have the same kind of social services programs set? I know that some it's statewide run. I know that others are. I'm just curious about, and I'm supposed to remember, but it's not a lot that are set up like this. But so if you all could send that to us. What's the longest amount of time that a child has been in foster care right now? I know they age out at 18, but then there's other services we offer. But I want to know how long someone has been in foster care. And then if you all could send us a real good explanation about termination of rights. I've been looking at that a lot. And it seems like sometimes we go for years and years and years with a child in foster care without terminating rights, and they get to the age where they're not as adoptable because of their age. So if you could maybe look at that for us. And are we having trouble getting assessments done on children? I've heard that we are having trouble getting assessments done. On page 21 in the first presentation, I'd like to know what is in other. There's a whole section of other. So I'd like to know exactly what's made up of that. On page 26, I'd like to know what costs are not covered on page 26. It says adoption, and it says we cover most cost. I want to know what costs aren't covered, and then what we can do to make sure we cover all costs for adoption. Refugee, I'd like to know what that definition is, and is there a state definition that differs from the federal definition? And then lastly, in public health, I'd like to know if the medical examiner is caught up, or how many current, what's the average waiting time right now for the medical examiner to complete an autopsy and get the results? I had one recently that the family had been waiting for weeks and weeks to receive the body back, and there were some extenuating circumstances, but I'd like to know what the longest it's taken to get a medical exam done, a autopsy done. Thank you, Mr. Chair.
Thank you, Senator Bergen. Chair Reeder.
Thank you. This is a question about the Home Builders Program. I know that you described it as evidence-based, and the local department's contract for that service, how do we assure that the providers are actually following the model and are having fidelity to that evidence-based group?
Yes, Francisco, you may.
Thank you, Mr. Chair. Thank you, Representative, for that question. I believe there is just one contractor that DSS is contracted with, and so that should ensure that throughout the state there is a standardized way that these services are being provided. The federal government also does provide oversight of these services, so that is an added layer that will ensure that these services are being provided in the same way as they should be, and also the regional support offices will be monitoring these in-home services as well. If there's anything the department wants to add to that, I'm sure they can if the chair wishes.
Sure. You might like to.
Lisa Colley, DSS. In addition to everything that you've heard before, the other thing that we do is when we pilot, we make sure that social workers who describe this program for families, who document progress, that they do that in a way that is in fidelity to the model. And so we don't just wait to see if it doesn't go right and monitor. Immediately when we implement, we look at what the workers in that county actually write and make sure that they're on target. You have to document that children are candidates for foster care, and the federal government makes sure you can't access the federal revenue if that's not absolutely correct. So there's a lot of both protection in what the model purveyor does with the contract, but also what the regional support staff that are available to county departments of social services, what they do in technical assistance as we implement.
Thank you. Chair White.
Thank you, Mr. Speaker. The energy assistance programs, can you talk just a little bit more about how that is processed? Are you using local companies? Are you using federal supported companies? How is that done?
Francisco.
Thank you, Mr. Chair. Thank you, Chair White, for that question. So I believe that the assistance benefits are administered by the county departments of social services, and the funds all come from federal block grant dollars. And for the low-income energy assistance program, the payments go directly to the utility providers, such as Duke Energy, so they don't go directly to the families themselves. Under the crisis intervention program, families can receive direct benefits if it's something like, home repairs, clothing, blankets, things like that.
The question, so when you mentioned home repairs and that kind of thing, is any of this money sent directly to folks like Community Action in the local communities, or does it all go through DSS and they may decide to, because I know Community Action gets a lot of federal dollars for this as well. So that's why I was just trying to figure out, are people sending, or is the DSS sending money to Community Action when they've already gotten money from the feds to do these home repairs?
May I answer, yes?
Thank you, Mr. Chair. Thank you, Chair White. I believe that the county departments are the ones that make the decision on what local service providers to contract with for certain services such as the home repair and replacement. Okay, and the department is nodding their head to say that I am not wrong, but there might be something that they want to add as well. Mr. Chair.
Somebody from the department would like to respond.
Thank you for that question. Carla West with Division of Social Services. Francisco's absolutely right. The DSSs generally contract on their own. We do, as a portion of the overall low-income household energy assistance program block grant that we get, do provide up to 15% of that block grant to the Division of Environmental Quality, DEQ, who also works with community action agencies providing other services. But the DSSs themselves might use some of those funds to help support local community action agencies.
Could I ask a follow-up with a question? So we don't think there's like federal money going from DEQ or to the local community action, and they're already getting their own direct federal dollars. I mean, is there some way that we keep that straight in terms of the list of clients that are being served so that there's not a duplicative kind of effect? And my area of the state has had a little bit of problem with that, and that's why I'm asking this question.
Thank you for that question. I can do some research and get back with you on that. I do know that the Division of Environmental Quality does have to send reports every quarter of all of the individuals that they serve. I am not aware of any duplicative services between their division and the funds that go to the local county departments of social services, but happy to research that for you.
Thank you. I have another question.
Sure. Chair White.
On page 22, when the foster care monthly payment rates, when we look at group homes, and this may be very obvious, but I'm not seeing it yet. Like 0 to 5, are we saying that the group homes get the old rate? Of course, we see that, but are we saying that the group homes are getting $4,506 per child? Is that what this is saying?
Francisco.
Thank you, Mr. Chair. Thank you, Chair White, for that question. That is correct. Looking at the group home rates there for children age 0 to 5, those group homes do receive up to $4,506 per month per child.
Follow-up. And the standard board rate for a licensed family home is $702 per child for the same age?
Thank you, Francisco.
Mr. Chair, that is correct, Representative White. Yep, for the per child, $702, age 0 to 5 for the licensed foster family homes.
Okay, thank you. One more question. On page 29, what is the average length of stay or time that a family would receive the work first? If we're talking about like a family that is working, is there a particular length of time that they have to start gaining some resources and not continuing to get this funding?
Francisco.
Thank you, Mr. Chair. Thank you, Chair White, for that question. So there is a federal rule that for families receiving TANF assistance, so in North Carolina's case, Work First, there's a 60-month lifetime limit for families to receive this assistance. Now, this does not apply to cases where there are child-only cases. So as you mentioned, this is really just for the cases with adults in the case. In addition, North Carolina has separate rules that dictate that for these cases with adults, they cannot receive assistance for more than 24 months continuously. So if a family with adults receives assistance for 24 months, they have to then be off the program and cannot receive Work First assistance for another 36 months, after which they can once again reapply and, if eligible, continue to receive Work First benefits, but again, still subject to that 24 continuous month limit as well as the federal 60-month limit. Data from 2021 showed that for the cases that do have adults, so those not child-only cases, the average household received assistance for 7 months, presumably after which most cases then no longer meet the income limits because they receive employment.
One more question. The child only, are they predominantly staying with other family members? And if so, is that about the same for that scenario, or is there a different?
Francisco.
Thank you, Mr. Chair. Thank you, Chair White. So for the child-only cases, I believe that on average, those cases do receive the assistance for longer than 7 months. I don't have that number with me, but I can look into it. Was there an additional question, sorry, that I missed on that?
That was it. Thank you.
Thank you, Francisco. Chair Gailey.
Thank you, Mr. Chairman. Our first question has to do with the first presentation. On page 30, it looks like I'm getting feedback. It looks like on the first page, on page 30, the number of Work First family assistant cases has dropped almost by half, from 12,000 to 6,700. And then I look at page 11 and I see that there's a budget of $81 million. So my question, I have a couple of questions about that. First is, how many FTEs are in the Work First department office? And then my second question is, if that's an opportunity to cut the budget, if they're doing have half as many cases, then do they need the same number of administrators, and are they giving out the same number of benefits?
I will look to Francisco first, and maybe the department can offer some insight too.
Thank you, Mr. Chair, and thank you, Chair Gailey, for that question. So, going back to that slide showing Work First, you are correct that the number of cases has been declining. I think ultimately what that can mostly be attributed to is the fact that the income limits are set in statute, and so they're fixed. And so over time, as you know, wages go up, it becomes harder and harder for families to actually qualify and be under those income limits. For example, individuals working full-time receiving the minimum wage, I believe, are not, surpass that threshold. So typically, cases with adults have to be non-working or not employed in order to qualify. The $81 million budget that you mentioned goes towards the benefit for workforce family assistance, as well as provision of services such as the job search, employment skills, transportation, as well as the more one-time assistance like diversion assistance or emergency assistance. Those $81 million are also combined with county funds, so it's not completely federal funds. There has been, due to this decline, a reduction in the amount of the TANF block grant dollars that are going to Work First. And in the 2023 Appropriations Act, I believe there was like a $4 or $5 million recurring reduction due to, as you mentioned, the declining caseload. And I can look into exactly kind of the estimated, outlook going forward, whether there's any room in the TANF budget or workforce budget to either, increase benefits or direct money to other services.
Thank you. I think we should put a pin in that to revisit during the budgeting process as we're working on coming up with the Senate budget. If there's an opportunity there to repurpose some funds to something else or to cut the budget. So then also on page 36, this is kind of one of my general questions about when we budget something for assistance for people, what percentage is used for administration? So when we say that we provided $9 million in the Disaster Recovery Act, Part 2, $9 million for energy assistance to households, what percentage of that actually goes to the household, and what percentage of it is, if any, is held out for administrative costs?
Francisco.
Thank you, Mr. Chair, and thank you, Chair Gailey, for that question. I can't remember off the top of my head. I have to look back at the provisions of this law. I think there might be some, small percentage of the funds that are allowed to go to counties for the administrative costs. I believe the department may have more to add if, Mr. Chair, you choose to.
Is anybody from the department?
Yes, Susan Osborne, DHHS. So these funds did not come with any administrative dollars. So for the energy, the only one that did come with some admin funds was the rental assistance, the $1 million, and that was 5%. So we asked counties to administer these funds and did not give them. Normally, they could use admin, for example, in the low-income energy assistance. They do have some admin funds, but no admin funds here for any of them except the rental assistance.
Thank you. I've always wondered about that. So another question. So on page 23, the number of foster children in inadequate settings, I think in your presentation you said it increased a bit, but actually we've gone up by a factor of 3 in 12 months. It went from November 23 to November 24. The number of children in both of those metrics tripled. And I would really like to know an explanation of why that is. What happened in 2024 that led to the number of children going into these temporary inadequate settings? I know that there's been a lot of discussion about this with the hospitals. The hospitals are very concerned about how this issue impacts their operations. So what insights do we have on why this is occurring?
Francisco, and maybe somebody from the department can respond as well.
Thank you, Mr. Chair, and thank you, Chair Gailey, for that question. So I do know that a lot of these children, in particular those with complex behavioral and mental health needs, and that's just, I think, a trend that following the pandemic has been increasing in youth, as well as the fact that while the rate of entries into foster care haven't changed too much substantially over time following the pandemic, there was a drop-off in the number of licensed foster families, and so that has also been a challenge for the state in having enough placements for children to go towards. If there are any further insights the department can touch on, I'm sure they'd be happy to do so.
Thank you for that question, Lisa Colley, DHHS. One of the reasons this data is actually, this is new data. In the past, we asked county departments of social services to turn in on a survey who they had boarding in their offices, and we got the hospital data from hospitals and LMEs, MCOs. This data is actually from foster care workers in their payment system, where they have to list where children are every night. And so some of the answer behind this data is it's a better method of data keeping. I would say that when you look at that spike in November, I couldn't answer affirmatively, but I would wonder if that's the seasonal nature of how we have the rises around the holidays of concerns with children, both the more entries into foster care, and also just more children experiencing needs that might place them in the EDs or in the SS offices.
Thank you.
One last follow-up. Thank you for that explanation. A last thing to put on your list to come back to is there's a question about for medications for the children in foster care. How many medications, if you can tell us, or prescriptions per child are those children on? If you could follow up with that. Thank you. Thank you, Mr. Chairman.
Thank you, Chair Gailey. I'm going to ask for one piece of information on vital records before I take some more questions. But one of the largest constituent complaints I've received in my office over the past couple of years has been with respect to birth certificates for adopted children, no-name birth certificates, things of that nature. I see in the report that Susie put together, there's an estimated time frame of turning that around in about 3 weeks. Even with my office calling, I have not seen a 3-week turnaround for vital records. Now, I think it has improved since we made some investments in the last budget cycle, but I'd be interested in learning more about that process, what some of the delays are, if there are any proposed solutions to expedite that. But I'm going to turn it over to the floor. Senator Adcock, I think I saw you had a question.
Thank you, Mr. Chair. My question is about the Office of Vital Records for Ms. Camilleri. I think it starts over on slide 23, and then it goes to slide 29. We're looking at digitizing all of these. It says the first phase has been completed. I think that's 61 to 70. What percentage, if you know or can estimate, what percentage of these vital records have been digitized at this point? What's the timeline for completion? And then I had a follow-up.
Susie.
Thank you, Mr. Chair. Thank you for the question. I don't know off the top of my head the percentage that have been versus still need to be digitized. I know that the older the records are, the more time it takes to digitize them and the more expensive it will get. So they started with 1961-70 and will move backwards from there. I did hear from the department that they will start with the next decade once they're finished with this sort of what they called a pilot or their first phase. They're already working with the vendor, and so hopefully they'll be able to streamline their processes and make it a little more efficient to do those more difficult records that they will still need to digitize. But I think if the department has additional information on the percentage that is still in the queue, they might have more data on that.
Right from the department.
Kelly Kemple, Division of Public Health. Thank you for that question. We can get, I don't know off the top of my head the actual percentage of overall records. We did start with the smaller subset and are looking forward to completing that first phase as we transition those documents into NC DAVE this spring. We are working on a broader timeline so we can get back to you as far as the plan with regards to the digitization of all the records. We have been working with the vendor as well as doing the necessary testing that is required to ensure that we have an efficient process moving forward, but we do appreciate the investment of the investment that was made to digitize these records so we can be more efficient in the future.
And a follow-up.
Thank you for that. You answered my middle question, which was obviously using a vendor. There's a lot more to this. It sounds simple, but to make sure you actually get a record you can use, when at some point you have to destroy the old stuff with the whole protocol for that. So my question becomes one similar to Senator Gailey's. Is the thinking that, and this might be a department question, I don't know, is the thinking that once these records are digitized and it's so much more efficient, not much faster certainly, but more efficient to find them, that there can be a lowering of the FTEs in this section because you will need fewer people to do this work because it's so retrievable?
Kelly, you want to take that?
Kelly Kimple, Division of Public Health, and thanks for that question. I think we really do need to ensure that we look at the digitization process to see what all is required for that. I think we have also looked to modernize our structure in the Office of Vital Records to ensure that we have the staff that we need to do the necessary work. So I think we will, something that we can definitely come back with some additional information, but we are going to have to ensure that we have the adequate timelines and turnaround times in order to serve constituents.
I'll just make one last comment if I could. And that is that's a good thing to just keep in mind, because sometimes that means you just have more forward-facing customer service people versus the folks putting their fingers on that could help your problem, Senator. Sorry, Richard. Faster turnaround time.
It's a good thing. All right, I think I saw Representative Crawford had her hand up first.
Thank you, Mr. Chair. My question is related specifically to the foster care piece of this, and I would like to understand what the state DSS office is doing, or what measures you have in place to ensure that our county offices are meeting standards in delivery of care, and what measures you have in place to support those county offices and meeting any gaps or discrepancies in how those offices are delivering care and getting positive outcomes.
Francisco, do you want to take that or kick it to the department?
I can provide some initial detail, and then the department can fill in, Mr. Chair. Thank you, Representative Crawford, for that question. So a big part of the supervision of counties has been that launching of the regional support offices, and a lot of that is for that, additional oversight and guidance provided to those 100 county departments of social services. There are specific metrics that the division does look at in evaluating how the counties are doing, and I believe most of those are based on federal guidelines as well. So I believe the department can now fill in with additional information.
Lisa Colley, DSS. Thank you for that question. We've spent a lot of time with our regional specialists looking at permanency measures, looking at timely initiation. Initially, we had one staff person about 4 years ago for each county, and they primarily focused on safety. And so we now have additional regional specialists that are specific to permanency. And so some of the things that they do right now are look at by county the number of children in the offices, and how counties can better access placements to get those children to a place where they can live. The other thing they look at is what can we do to speed up timely permanence? Now, I think there are also metrics that we look at. How long are children in care, or what are the benchmarks? How long do we work towards reunification? But there's also another element that we have to bring into the picture here, is how do the counties interface with courts? Do their court summaries provide judges information so that cases move forward? But also helping counties make local cases for additional court time, because some of the delays we see in permanency really are because kids stay too long, and the courts take too long. And so looking at that. The other thing that we're focusing on is how do we help support foster parents? If you think about foster parents today, if children stay in foster care too long, then you have foster parents that fall in love with them that want to adopt, but you have that whole court process that is slow. And so looking and helping counties, how do you mitigate that? How do you help foster parents understand the delays, make sense of it? And then the other thing we look at is workforce. Everything we do has to be for a changing workforce that turns over. And so we have done a lot of work around our training, making it more accessible, and trying to get people out of training sooner with more skills so that they can meet the needs of children and families.
Quickly, and I'll just say we have 8 more minutes.
Yeah.
I think, I see a lot of hands up over here.
Just quickly want to add that another initiative is looking at modernizing this work and ensuring that we have significant increase in the pathways to permanence. What are the ways other than just the traditional termination of parental rights?
Thank you. Representative Cervoni.
Thank you so much, Chair. I do have 2 questions for the Division of Social Services on permanency as well. 2 questions. One, on kinship care rates, we last biennium was able to provide kinship rates, but only to half of what we do for our other rates. have you all seen any improvements on that? And that, is there some evidence that maybe we should bring up that rate to equal? That was my first question.
Francisco?
Thank you, Mr. Chair. Thank you, Representative Servania, for that question. So I do, on this slide, show that, the rate of families or children being placed in these unlicensed kinship homes does appear to have increased slightly since the start of this program of assistance rates being paid. As far as any further initiatives that can be done, I'll let the Department of Health and Human Services elaborate on those.
Lisa Colley, DSS. Thank you for that question. We're really excited about having a kinship-specific license. So that kinship-specific license was piloted and started in January, and we already have at least, it was 2 families by the end of January that were licensed kin-specific. So one of our hopes is that families who receive the kinship funding will take that opportunity to become licensed as a kinship care foster parent.
Very good. And then follow up.
You may, yes.
So with 84% of our child cases being neglect, how have the programs to keep kids together with the reunification of families, how's that been? And what is our percentage of recidivism in that space?
Francisco, do you want to let the department take that, or?
I can
Okay.
provide some initial information, Mr. Chair. Representative Servania, thank you for that question. So with neglect, a lot of cases of neglect sometimes have to do not so much with abuse, but rather the social worker finds that there is it could be inadequate housing, not enough food, not enough supervision, not enough child care being provided. And so, as I mentioned, some of the in-home services, which are being currently, in place and also being rolled out, do try to get at those instances where, families or parents, especially new parents, just need to be provided with supports and education on how to not be neglecting their children. And I'll let the department fill in with further information, Mr. Chair.
Thank you.
Lisa Colley, DHHS. So thank you, Francisco. That was right on point. The other thing I want to point out is when you think about some of the new services we're launching, like Home Builders, which comes in and helps families understand how to run their household, how to meet their needs. We do a lot of training with our social workers about how to access resources in their counties, but that doesn't mean they always have the resources they need to send families to. The other thing, if you look at that START, sobriety treatment and response teams in counties, that is a model we're piloting that addresses substance use disorder and has a specific social work practice in county departments of social services. So those families are supported as well. So when we think about the neglect, we do think about all the things Francisco mentioned, but you also think about the neglect that happens when there's substance use disorder. So you have to address both.
Thank you. Representative Campbell, I see you had a hand up, or?
Thank you, Mr. Chair. 2 questions, and if you, in the interest of time, if you guys just want to send this to me instead towards the whole committee is fine. On slide 34, you had a entry about state maternity home fund. I'd just like some more information about what that is. And then the second question, it had been talked about before, and it may have happened. If it has, I apologize. But with NC Dave, with death reporting, we had this issue even before it was online, is that fetal death, in terms of doing the death certificate and things, it's just different. It just doesn't follow the protocol of every other death certificate we do. And there was some entertaining of possibly having a separate category of reporting a fetal death to get that information. Has that happened, or is it being considered? And Mr. Chairman, in the interest of time, if you guys just want to follow up with me by email, that's totally fine. Thank
you, Representative Campbell. And if to that question, if you'd like to follow up by sending it to the chairs, we'll make sure it gets out to all members of the committee. So thank you for that. Representative, I think I saw your hand up.
Yes, sir. Thank you, Mr. Chair. I think this is for Francisco. Under page 26, foster care adoptions, are there income requirements on receiving these funds? And it says most adopted foster children are eligible. Why isn't it all?
Francisco.
Thank you, Mr. Chair. Thank you, Representative Ullman, for that question. So The requirements for who can receive adoption assistance are set by the federal government, and to my understanding, there are no income requirements for the adoptive family to receive these adoption assistance payments. As far as why there might be cases where there are adopted children from foster care that are not eligible, I'd have to do a bit more research and get back to you. I do believe that is a small minority of cases, but I'll get back on some of the details for that.
All right, it is 10 o'clock. Is there any final question or comment from the chairs? I will adjourn us till tomorrow morning.